Hello! So today I wanted to talk about something that a lot of people don't talk about in the rehab world, or at least I feel like, in my opinion, and it is abdominoplasties. So an abdominoplasty is a surgical option to repairing your diastasis recti. So if you look at my previous post, we talked about diastasis recti. What is it? How do you assess for it? Why do you get it? And how do you rehab from it? And a lot of people do great with rehab. I love rehabbing diastasis recti. It's a big passion of mine, and it's just exciting. It's a lot of work, and it's a lot harder than people think, but it's awesome. But the reality is that for some people, no amount of exercise, no amount of dieting or anything will actually repair their tissues. It won't fix their diastasis. And to have a surgical option is not only necessary, but wonderful. And so I took it upon myself. I wanted this summer to start interviewing plastic surgeons here in the St. Louis area that were well known for this, and just kind of get a feel for their bedside manner, get educated by them, and then have a Rolodex of people that I would feel confident and comfortable sending my clients and patients to. So with that being said, the very first person I interviewed was Dr. David Kaplan. He is off Ballas and Olive Boulevard with Parkcrest Plastic Surgery. He is phenomenal, in my opinion. He's very wonderful, very nice, educated, well accredited, and really took his time to answer any questions I had and just sat down with me and really explained things thoroughly. I highly recommend him. If you're considering something like this, please check him out, and it would be worth your time at least. So to get into a little bit more about the procedure itself, so Dr. Kaplan's approach is that they make an incision along the bikini line, and then they work upwards and they repair as deep of a layer as they need. So as you guys have learned from previous posts of mine, that the abdominals, there's multiple layers, okay? It's not just 8-pack abs or whatever. It's not just the recti. There's a lot of tissue and multiple layers. So they will go as far as they need to, or as deep as they need to, and then they start to repair from the inside out as well as down. And then they can also go laterally to the obliques if needed, and they will discuss that with you during your assessment and what your outcomes and goals are. And they discuss that in detail with you guys prior to surgery. He educated me that there are different types of surgical approaches. His approach, though, instead of utilizing one suture, he actually does multiple sutures, okay? So they're individual sutures. And the reason being for him is that even though it may take longer, if you were to use one suture, if anywhere along that suture breaks, then it compromises the integrity of the chain. Whereas you have individual sutures, then if one of those breaks, the entire chain is not compromised. In my opinion, and also the research that I have done, that actually is a very, very good approach. So he also will save your belly button. I know that sounds funny, but so with the abdominoplasties, they will also remove excess skin, because as a lot of us know, when we have babies and our abdominal walls expand, the tissue integrity of our skin even is compromised, and it doesn't always go back. And it's not fat, it's not anything other than the quality of the tissue itself and the laxity and the contractility of those skin ligaments. And so we have a lot of excess skin, and they will remove that, and then they'll, there's a lot of, I guess, placement as far as like how far down they pull or pull up. I'm not really quite sure. Discuss it with him. But they do try to save your belly button, so it's not like you're gonna walk out of there without a belly button. I heard in a podcast, by the way, that is actually a good plastic surgeon should be able to do that. May not be able to in all scenarios, but it's something you definitely want to discuss. But Dr. Kaplan had explained to me that he does individual sutures, and then they remove the excess skin. They do save the belly button, and your rehab is about 4 weeks. So it's 4 weeks of you being on a restricted. You have a lot of restrictions. You can't lift things. You probably, obviously, you would not be able to exercise as much and things. But it's only about 4 weeks, and then afterwards, my personal opinion is that post-rehab is very much important, because once you're healed, and obviously this would probably be more in the 8-week mark. I have rehabbed a lot of women post abdominoplasties so they can reutilize and engage those muscles, learn how to coordinate them again, expand their abdominal walls, as well as educate them and take the fear out of it as far as they're not going to injure themselves, they're not going to tear anything, and they can really start building strength again, functional strength even. So yeah, and then I guess that's about it really. It's a great option to have. It's very much needed for a lot of women, and I think that if you have any questions at all, I highly recommend that you reach out to Parkhurst Plastic Surgery and set up an interview with Dr. Kaplan and see what he says. Everybody is different, every case is different, but just based on his time that he took with me, he will really give you the time that you need and just discuss your situation. Ooh, that was what I was gonna remember. One last thing. A lot of my people, a lot of my patients and my clients and even my friends are not done having children. And so that is something you want to talk to them about. So a lot of plastic surgeons will tell you that you need to wait until you're done having children before you were to do a surgery like this. I had asked him though, does it happen? People have the surgery and then they can find out they're pregnant later. Is it going to damage anything or tear anything or jeopardize the baby or the mother? And he informed me that no, baby and mom are both fine and you're not going to tear anything necessarily. It's just, it will compromise the integrity of the surgery. So, you know, when they're done, everything is nice and put together. So when you were to get pregnant again, obviously things will expand. And so will it expand to the degree that it was prior to your surgery? Most likely not. But it will not look the exact same post-surgical. And I asked him, if, you know, is that pretty common? And he said, yeah, pretty much all plastic surgeons agree with that. So not necessarily a contraindication, but definitely something that they highly suggest that you wait until you're done with having children. So please ask that question if you are not done having children or if you're just not sure. Go and have an interview and just talk to them about it, okay? I will hopefully have another interview here soon and I will jump back on and tell you guys about another option here in the St. Louis area. All right, talk to you later. Bye.